Good day, ma'am. I am Ara Cara D. Medalla. Today, I will going to explain the following: home care and hospice, community-based services, assisted living, special care units, and the geriatric units. So the first one is the home care and hospice. When we say hospice, it is a place that provides care for the people who are dying, and home care is caring of people at home. So home care and hospice focuses on its different sides. Home care focuses on the patient's rehabilitation and medical management in order to improve the patient's medical condition, while hospice, while hospice care focuses on supporting the patient who is terminally ill by providing a comfort measures to assure the comfort and quality of life of a patient. So most patients who receive a hospice care is came from a Medicare certified hospice organization, which includes the interdisciplinary team consists of a physician, nurse, hospice aider, social worker, volunteer, bereavement specialist, and the chaplain. When we say chaplain, that is a priest or any religious leader who performs a religious activities. So, hospice at homes services aims to enable patients who have a illness to cared at home and die at home if that would be their preference. Next one is the community-based services. Community-based is refers to a philosophical approach in which communities have an active role and participate in highlighting and addressing the issues that matter to them. It encouraged the people in the community to design, develop, and deliver intervention and prevention strategies. In this case, the community members will be able to identify the issues and they can work together to address those issues. Example of the community-based services is caring for our older adults. As we all know, older adults is the pillars in our community. They have both knowledge, skill, experience that can benefit our society. So we must acknowledge our senior citizens and their contributions to our society. Example of this is the adult daycare centers, which is became fairly common. Adult daycare centers provide a wide range of social and support services in our older adults. Mostly, it is set up in the churches and the community centers. So adult daycare centers usually used to care for the people who needs supervision and help in their activities of daily living, such as those patients having dementia. Dementia is a general term for loss of memory, language, problem solving that is severely interfere with our activities of daily living. It is commonly caused by Alzheimer's disease. So the purpose of community-based care is to maintain the health and well-being of elderly, prevent them from getting sick, help them to care for the minor health problems and long-term conditions, and lastly, make sure that they recover from illnesses and hospitalization. The next one is the assisted living. Assisted living exemplifies the shift from care as service to care as business. Assisted living evolved in a small board and care or person care homes. An assisted living has its residence or assisted living facility in which it is a housing facility for the person with disabilities or for adults who cannot or choose not to live independently. The term is popular in the United States and the setting is somewhat similar to a retirement home in the sense that facilities provides a group living environment and typically cater in older adult population. Assisted living provides a healthy lifestyle and social engagement. The most common assisted living services offered is the assistance for bathroom, dressing, and grooming. Assisted living has three levels of care. Generally refers to how much a person needs assistance. The first level is the low level of care, which is in this level, the resident is mostly independent but may need reminders to perform activities of daily living. Some may require low level of supervision and assistance to ensure that the task is performed correctly and safely. The second is the intermediate level or the moderate level, which is in this level, the resident may be independent with some activities of daily living, such as feeding oneself, but may need help with others, such as getting dressed. The last level is the high level of care, which is in this level, the individual has impairments that affect the multiple activities of daily living and may require a comprehensive level of care from a multiple caregivers. The next one is the special care units. A special care units, it is a appropriately equipped unit in the hospital which they provide a intensive care, coronary care, respiratory care, psychiatric intensive care unit, burn treatment, and other specialized care, which has the concentrations of physicians, nurses, and others that have a special skills and experience to provide a optimal medical care for the patient assigned in that kind of unit. So, special care units caters those patients having an illness called dementia. They are usually in a physically separate space from other patient population. The last one is the geriatric unit. Geriatrics derive from the Greek word gerus, which means old, and iatrikos, which means healer, pertaining to a physician. Geriatric also means related to old age or caring of an aged people. Geriatric Intensive Care Unit is a special intensive care unit dedicated to management of critically ill elderly. Geriatrics is commonly used in a phrase geriatric medicine, also called geriatrics, which is the branch of medicine dealing with the care of aged persons. Geriatric units has its intervention to provide a principle of appropriate environment that encourage safe patient self-care, a set of guidelines for bedside care by nurse and other healthcare professionals. Take note, geriatrics and gerontology are different to each other. Geriatrics is a care for aged people, while gerontology is the study of aging process itself. That could be all. Thank you for listening.